Et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-parole aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'honorable Dorothy Shepherd, ministre de la Santé. Good afternoon, everyone.
Bienvenue à la mise à jour sur la COVID-19 au Nouveau-Brunswick. Les porte-parole aujourd'hui sont la médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'honorable Dorothy Shepherd, ministre de la Santé. Dr. Russell.
Good afternoon, everyone.
Bon après-midi à tous et à tous. Avec chaque jour, plus de gens du Nouveau-Brunswick sont vaccinés contre le COVID-19. Plus de 150 000 de nous au Nouveau-Brunswick avec un quart de la population.
Vaccine. And this is very good news for our province. Yet we are continuing to see rising number of COVID-19 infections in New Brunswick, and more people are becoming ill and needing hospitalization, particularly among young people. Les vaccins contribuent à ralentir la propagation.
Vaccinations contribute to slow the propagation of this virus, and scientific data and what's happened in other pays are proof of it. Vaccinations, however, are the most efficient when they are used in parallel with other public health advisements that continue to be respected up until we are all vaccinated with at least one dose. The fact of having received a vaccination seems to have created false sentiment of security for some citizens in New Brunswick.
COVID-19 over the next 10 weeks depends on these four things: limiting the spread of more transmissible and severe variants of COVID-19, maintaining public health measures during the vaccine rollout, rapidly vaccinating as many New Brunswickers as we can, and the effectiveness of vaccines in protecting against severe symptoms, ICU admission, and death, but only when we've all had at least one dose of the vaccine will we all be protected from ICU admission, hospitalizations, and death. If you have been vaccinated, don't let that give you a false sense of security. Now, we do know that most people who are vaccinated will be protected against severe symptoms, hospitalizations, ICU admissions, and death. But remember that we won't all have one dose of the vaccine on board until at least the end of June. So there will be still a significant portion of the population that won't be vaccinated and protected against those severe outcomes. I want everybody to understand that COVID-19 will continue to pose a risk. Even after we've had our one dose, we all want to get to that two-dose maximum protection against variants and COVID-19. People can contract COVID-19 after being vaccinated. We are getting more data every day on the transmissibility. And at this time, when we see somebody who has had a vaccine test positive for COVID, they have very, very mild symptoms or they don't have any symptoms at all. So these asymptomatic carriers can spread the virus to others who have not been vaccinated, resulting in further spread. So when we see these cases, again, we get very concerned, and we do need everybody to know that we can still get tested, we can still get vaccinated, we can still get COVID-19. After you get your vaccine, please still continue to be vigilant about watching for signs and symptoms and get tested if you have any mild symptoms.
Recently, we discovered that a person who is immunized in other countries and come to New Brunswick, they can still be susceptible to be infected with COVID. So that's what we understand. We continue to learn that people can be vaccinated and still be able to be infected by COVID-19. That's why we must all continue to wear masks in public spaces and maintain 2 meters of physical distance from others whenever possible.
Work when we're not feeling well. That's why any travel that comes into our province from outside the province, outside the country, still remains risky. So if you're hosting somebody who's arriving from another country or from outside the province, you really need to be very careful about the self-isolation. Ideally, you should not be self-isolating in the same household. We all need to be watchful of symptoms of COVID-19, even those of us who have been vaccinated, and seek testing when symptoms emerge. With the emergence of more contagious variants of COVID-19, it is more important than ever that we remain on guard. And we are now in the third week of the outbreak in Zone 4, which is the Edmundston-Grand Falls region. Of the 140 active cases of COVID-19 in New Brunswick, 104 are in Zone 4, mostly in the lockdown area. The Edmundston area will remain in lockdown for at least one more week, and public health will reassess the situation at that time. There remain a number of cases of community transmission in that area, as well as numerous incidents of public exposure to the virus. And I just want to show 2 slides that will demonstrate why the lockdown has to continue. So the first slide is a map that shows the cases in the lockdown area as they appeared on April the 7th. So you look at each dot and they represent a case, and the lines that are connecting them are related to other cases. And you can see 3 large clusters there. Some smaller groups and individual cases that haven't been linked to the existing cases. There were also 13 cases that were under investigation at that time. Now fast forward to yesterday. So this next image shows the situation in lockdown as of yesterday, and we still have 3 large clusters of cases and a few unrelated cases outside of these groupings. We still have 19 cases which we cannot conclusively link to any of the existing clusters. There are some promising signs in the lockdown area. The number of hospital patients in intensive care in that zone has declined over the last few days. That is very, very good news. We need further evidence of improvement before ending the lockdown order. There are continuing to be new cases every day, and the contact tracing continues to be a challenge, and we're working very, very hard at protecting everyone in that community. There have been more improvements in the Grand Falls and Drummond area, and public health has recommended that this area move to the orange alert level effective at midnight tonight. Aujourd'hui, Santé publique confirme.
Today, public health confirms that there are 8 new cases of COVID-19 in New Brunswick. There are 4 new cases in Zone 4. There are 2 new cases in Zone 1, that is the Moncton and Southeast New Brunswick region. There's 1 new case in Zone 2, which includes the counties of St. John, Kings, and Charlotte, and another in Zone 6, that is the Bathurst and Acadian Peninsula region. That presently 18 citizens in New Brunswick were hospitalized due to COVID-19, of which 12 in intensive care.
Confirmed 8 new cases of COVID-19 in the province. There are 4 new cases in Zone 4, 2 new cases in Zone 1, which is the Moncton and Southeast New Brunswick area, Zone 2, which is St. John, Charlotte, Kings counties, and Zone 6, which is the Bathurst and the Acadian Peninsula, have seen 1 case today. There are 18 New Brunswickers in hospital due to COVID-19, which includes 12 who are in intensive care.
Once again, I'd like to express my gratitude to the citizens of the Edmundston region for the efforts that they continue to show in order to slow down the expansion of this virus. The determination that they continue to show in these difficult times merits our admiration and our support. If your friends or members of your family live in the lockdown zone, I encourage you to come into contact with them.
Support them in this challenging time. And if you are posting anything on social media, I hope that it is something encouraging. While the lockdown continues, I want to remind the people of Edmundston that they can go out and keep their vaccine appointment or seek testing for COVID-19 when they don't feel well. It's very important that all New Brunswickers continue to seek testing when they're experiencing symptoms, particularly everyone, including people who have been vaccinated. Your own health and that of your family and friends remains at risk so long as the majority of New Brunswickers remain unvaccinated. We have a ways to go to get to the end of June so that everybody can get that first dose on board. If you feel that you have a spring cold or a mild flu, it's probably COVID-19 or one of the variants. Please get tested, even if you've been vaccinated. Given the number of cases that we have seen with no symptoms, we are expanding our testing protocols to include some asymptomatic testing. So if you have been in a location where you may have been exposed to COVID-19, we have so many public exposures that we've been publicizing. So you should seek testing even if you have no symptoms. Don't take chances with the virus, especially now, because we are assuming we are actually treating every case right now as if it is a variant of concern.
We're at a point in our struggle against this pandemic where we know what we have to do, but we're probably just exasperated by it. We all want to know when we'll be able to toss out these public measures and forget about them.
We want to know when we can leave our masks at home, and the answer is not yet. COVID-19 is still with us, and it will be with us for a while until we all have our 1 dose of the vaccine by the end of June. And at this time, we will be protected, for the most part, against ICU admissions, severe symptoms, and death. Therefore, the measures that have helped us to slow the spread of this virus up until now must remain with us as well. So we can't let up now. Whether or not you've been vaccinated, please continue to follow public health guidance and advice. Que vous ayez ou non été vacciné.
Whether you're vaccinated or not, please continue to follow public health guidance and advice.
COVID-19. It can happen. In the meantime, we all have to continue to protect each other, especially those who have not been vaccinated, by following public health measures. Once you are vaccinated, you will be better protected against COVID-19, but your family, friends, and neighbors may not be. Please help to be sure, as we continue through our pandemic journey, that no one is left behind. Thank you very much.
Good afternoon, bonjour. Earlier this week, the Council of Atlantic Premiers made the difficult decision to postpone the opening of the Atlantic bubble until at least May 3rd. This was not news any of us wanted to hear, but we all realized the decision was necessary. The number of new cases of COVID-19 in our province continues to rise, as do the numbers of cases caused by the UK and South African variants. It is more important than ever that we do everything within our power to slow the spread of these viruses. This is why Cabinet and the All-Party Cabinet Committee on COVID-19 have accepted the recommendation of Public Health that the area in Zone 4, currently in lockdown, including Edmundston and the Upper Madawaska region, remain in lockdown under the province's mandatory order. Public Health will reassess the situation in 7 days. No travel is permitted in and out of the lockdown area or within the lockdown area except when necessary, such as for vaccinations, medical appointments, work, or to purchase essential goods. Please note that you do not need to travel to a Service New Brunswick location outside of the lockdown area to renew your license or registration. Most services offered by Service New Brunswick are available online at www.snb.ca or by calling SNB Teleservices at 1-888-762-8600. However, if you are unable to complete the service you require online or by phone, the mandatory order allows for an extension of licenses, registrations, certificates, and permits that were valid on April 9th when the lockdown began until 10 days after the lockdown ends. Also, on the advice of Public Health, the area in Zone 4, including St. Leonard, Grand Falls, Drummond, New Denmark, and Four Falls, will move to the orange alert levels under the province's mandatory order, effective at midnight tonight. For those moving to orange, restrictions are loosening a bit. Your household bubble is expanded to include 10 contacts from outside your household. Masks are mandatory in indoor public spaces, as well as in outdoor public spaces when physical distancing cannot be maintained. Masks are also required when accessing food through the drive-through window. You can dine in restaurants with members of your household and your steady 10. Gyms and fitness facilities, as well as salons and spas, can open, as can entertainment centers with the proper precautions in place. In-person services at faith venues are limited to 50 or fewer participants, depending on the size of the facility. Recreational and sports organizations may operate, but are limited to practices. While progress has been made in the Grand Falls area, the risk remains and public health guidelines must be followed. Do not travel between areas at different alert levels. Those who live in the area that is moving to the orange alert level are not permitted to travel into the lockdown area and should not travel into areas at the yellow alert level unless it is essential to do so. We know that this virus does not move on its own, so the less we move, the less opportunity there is for the virus to spread. The Saint-Quentin and Keswick regions, along with the rest of the zones in the province, will remain at the yellow alert level. I want to thank everyone for continuing to take precautions and working together to keep their loved ones and their communities healthy and safe. This pandemic has shown us how even the smallest acts, such as choosing to wear a mask, can have a big impact. Our vaccination rollout remains on schedule, and I'm proud to be able to say that we are close to having vaccinated 25% of the New Brunswick population with at least the first dose of the COVID-19 vaccine. This is an important milestone and puts us closer to a return to normal. However, as Dr. Russell has said, we must not become complacent. Even once you have received a vaccine, you must continue to follow public health rules, such as wearing a mask in public spaces and maintaining physical distancing. This will help us keep everyone safe. As well, those who are eligible for vaccines and wish to receive one should make an appointment to do so. I want to remind everyone that it is important to schedule your appointments in advance, whether they are through a pharmacy or a clinic offered by Horizon or Vitalite Health Networks. Pharmacies and clinics know in advance how much of the vaccine they will receive and book appointments accordingly to ensure that all the vaccine is administered. Because of the need to plan in advance, it could take a week or two for you to get an appointment. Please keep in mind when you are contacting a pharmacy or a clinic. If you meet the eligibility requirements for vaccination and have not yet received your vaccine, please visit gnb.ca/book-a-vaccine. People over the age of 55 are eligible to register for clinics for AstraZeneca. And if you know someone who is eligible to book an appointment and hasn't done so, reach out and make sure they know that they are eligible. If you need help booking an appointment online, If they need help booking an appointment online, please offer to help them. Or if you know someone who is unable to get an appointment because they have no way to do so, offer to drive them. Just be sure to follow the carpooling rules on physical distancing. I want to stress that we are not sitting on doses of vaccine in this province. All of the vaccine we have is spoken for. There is a process that begins when doses of the vaccine arrive in our province and are recorded as received through to when they are recorded as administered. And this process can take from 2 days up to a week. But make no mistake, any vaccine that we have in New Brunswick is accounted for in our rollout plan and will be administered to residents in a timely and efficient manner. In fact, we are accepting every dose made available to us. Recently, when the federal government indicated there were 2,500 additional doses available, and New Brunswick was eligible for 100 of them, we asked for those doses and we added them to our plan. We are making progress. We have proven that when required, we can do hard things. Be proud of what we have achieved and what each of you continue to do every day to keep your family, friends, and communities healthy and safe. You are making a difference. If you are feeling overwhelmed, please remember that you are not in this alone. Reach out and ask for the support you need. We have gotten this far by working together, and together is how we will get through these challenging times. Thank you. Merci.
Merci beaucoup. Thank you very much.
Dr. Russell.
We'll now proceed with questions from members of the media.
On passe aux questions de la part des médias.
One question and a very, very quick follow-up. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Nous allons maintenant procéder au...
We'll now proceed to questions from the reporters. You'll have a right to ask your questions in the language of your choice. Each reporter will have one question and a short follow-up. Make sure to mute your mics. Travis Fortnum, Global TV.
Hi there. My question could go to either the minister or Dr. Russell. We've heard that the Edmonton area, given their tough circumstances, are going to be receiving a higher volume of vaccine. I'm just wondering if you're able to put a number on that, either a percentage of how much their vaccine doses are going to increase or actual dose numbers.
What I can confirm for you today is that the province is just under 25% vaccinated, but in the Zone 4 area, we're a full 10% above that. We're at 35.4, I think. So we have allotted as many extra doses as we can to go to that area, and I'm just looking to see if I have the numbers. No, I don't think I do. I don't have the anticipated extra numbers this week, but we do have many clinics booked for this week in all zones, including Zone 4.
Mr. Fortnum, do you have a follow-up today?
Yep. So if they're getting vaccinated at a higher rate than the rest of the province, won't that theoretically mean that they'll see lower age groups getting access to vaccines before the rest of the province, or will we just slow down the doses that get shipped to them?
Well, we've already made AstraZeneca available to 55 plus, and they have to book through the RHA clinics and pharmacy for that. But essentially, we're trying to get as many people as we can in Zone 4 vaccinated, because when we reach a higher level of percentage, we should get some help from that in severe cases. So that's the goal.
Thank you. Laura Brown, CTV.
Hi there, Minister. I'm wondering how you go about tracking. I understand for people, Quebec and beyond, but for Nova Scotians and Prince Edward Islanders, how do you track them coming in and if they're isolating, if we're not seeing them at the borders?
Well, anyone traveling in and out of the area is required to apply for a travel, a travel authority. And so as when they come into the province, as of the date of their registration, then there will be follow-ups through public safety. Some of that's done through automated calls. I think public safety told us this week that they are endeavoring to do a minimum of one in-person visit.
Thank you. Ms. Brown, do you have a follow-up?
I'm just looking for an update on the variants. There's, I think, over 100 active cases in the Edmonton region. Are you considering all of those UK variants? And can you give us an update on the 2 South African variants that were found?
The answer to the first question around the variants in Zone 4 is yes. Most of them are UK variant, and we are presuming that all new cases are variants of concern, whether it's UK, South African, or the Brazil variant. We haven't seen the P1 variant here yet, but what I can also tell you is that so 184 cases were confirmed as variants of concern. So 180 were the UK variant, 135 cases are recovered, and 45 cases are active. And those are in Zone 1, 2, well, they're actually in all zones except for Zone 5. The South African variant, we have 4 cases, and they're all active. There are 2 in Zone 2 and 2 in Zone 3. And from March 1st to April 15th, we have confirmed the UK variant in 63% of the cases in Zone 4.
Thank you. Vicky Hogar, CHCO TV.
Thank you, Bruce. My question is for Minister Shepherd. There were exposure notifications posted yesterday for both Campobello and St. Stephen. There are just over 900 people on Campobello, many of whom cross the border regularly, either for essentials or for work or for both. Has there been any discussions about vaccinating all eligible people on the island?
I'm going to say that public health is always considering options, and I know that the question has been put forward. We have not received any official word back on that yet. I think it's also important to note that the cases in that area are low, and so in zone 2. So I think that we need to keep following public health measures, and that we have also increased testing in the Charlotte County area. So it's really important. Public health measures work. And we've also encouraged people to travel only when they need to. So I know that Campobello has unique circumstances, but we're asking people to curtail any unnecessary travel.
Before we go to your follow-up.
Oh, I just wanted to confirm what Minister Shepherd was saying about the increased capacity for testing in St. Stephen, Charlotte County.
Thank you. Ms. Hogarth, your follow-up, please.
Yes, that would actually just be my follow-up. I'm just wondering what the increased testing is in the Charlotte County region.
Hang on. So the testing, we have extended hours in the locations. If I'm not mistaken, they are in pharmacy? No? Sorry, Vicki, we just need to be sure. At their testing sites that are already set up. Vicki, I apologize about that. So the testing has been increased at the testing sites and with extended hours.
Thank you.
Jean-Philippe Hughes, Radio-Canada.
Oui, bonjour.
Yes, my question for Dr. Jennifer Russell. We're at 3 different colors within Zone 4, orange, yellow, and lockdown. Do you fear that people are becoming mixed up in that region? No, not necessarily. We try to have meetings with the leadership in all these places to make sure that it is clear that number one is what are the reason for the different measures that are in place and why we're going to change the measures and why we're not going to change measures in the lockdown. And so it really is specific about the risks and about the number of cases. So I hope that people are not too disappointed with the different colors, but it was really to manage the situation with the risks respectively. Do you have a follow-up? Yes? In the case of a zone like Zone 4, there are certain times that we have cases and complicated sanitary cases. Does it not show that these health zones are maybe too large finally with the problems like the present clinics at the present time? I understand the question. I understand all along the pandemic, the way that we manage situations in each zone with the hospitals and the health services, because each zone, if there are too many cases, it's going to impact the health system within the zone. So at the present time, because the information that we're receiving now on the variants and the outbreaks and the way that we're managing the situation and the quarantine for people who are contacts, we're more confident that we can manage the situation with more specific measures within the zones. Thank you.
Hi, my question's for Dr. Russell. I'm wondering if you can describe generally what kinds of transmission patterns we're seeing in the province at the moment. Is it mostly restaurants, or are we seeing spread in households, care homes? Are gatherings contributing?
Well, as you know, the highest number of cases are in Zone 4 that are active right now, and there are various different settings. There are workplace settings, there are an adult residential facility. I would say that in the red and the lockdown phase, obviously people are with their one household their one household bubble. So they would not be gathering, hopefully, in those types of situations. So I think it's, with a variant like the UK variant, it's 30 to 70% more contagious, so it is much, much easier to transmit. And the travel-related cases still continue to happen all across the province. So any of the new cases that we see are usually travel-related. We always hope that they don't spark a new outbreak in the zones that they have arrived in. And that's why the self-isolation is so important. And if you can self-isolate in a separate location, then you should do that. And the retail settings, we have seen some transmission there, and workplaces.
Ms. Saad, do you have a follow-up?
Yes, I do. Thank you, Bruce. So I guess just to confirm then, so are we seeing kind of, a lot of travel-related cases that spread a little, more so than, one case that causes a whole bunch of other cases? And I guess I'm wondering if you have an update on the cases in long-term care homes as well, in Zone 4.
So in terms of the adult residential facility, we're continuing to test people. They did move them to a separate facility to allow for isolation. And that's been very helpful. And the vaccination rate in Zone 4 is higher than anywhere else. So our prompt team was activated. We're testing the residents and the staff. So 12 residents and 10 staff have tested positive already, and we're testing again today. The Roland-Long Zone 4 facility has 7 residents, and the prompt team was activated there as well. 4 residents and 5 staff have tested positive. They're going to test there again today. And in terms of, the other travel-related cases around the province, obviously we're watching them very closely. The contact tracing is extremely important. And obviously, when it's a travel-related case, we do expect people to self-isolate properly for 14 days. We expect them to not be picked up at the airport by a household member. We expect them to not make detours of any kind and run errands on their way home to their self-isolation. So this is really important for everyone, again, who is receiving or hosting a person traveling into New Brunswick from either outside the province, elsewhere in the country, or from outside the country.
Thank you. Simon Delatte, l'Acadie Nouvelle.
Acadie Nouvelle. You guys have a question? What? I cannot understand what's being said. Interpreter regrets, but I cannot understand what's being said. No. Monsieur Delache, could you repeat the question and get closer to your mic, please? Or Zone 4 has been hit hard. So we have a third lockdown. I don't know if it's... I'm just wondering if there was specific support for the region would be available. I can answer the question the way I understood. It's just the fact that there's so many lockdowns in that zone that businesses are affected. There's a very negative impact on the businesses. Was anything going to happen to support people who have businesses in the region, in that zone? Precisely.
I can offer that Minister Dunn has been talking with some of the local leadership there in Zone 4, because we do know that through Opportunities New Brunswick, we believe that there are going to be assistance required. And so while that has not been completely defined yet, Minister Dunn is aware, as is Minister Alain, and we will be working with them.
Merci. Simon,
Simon, you have a follow-up question?
merci beaucoup.
Thank you.
Achard Radio-Canada.
Julien,
Oui, bonjour. Ma question est pour vous, docteur.
my question is for Dr. Jennifer Russell. Dr. Russell, I had an interview concerning exchanges in the field of health with PEI, notably, that have increased since the beginning of this pandemic. I'd like to know, Dr. Russell, how are the exchanges with PEI, since is PEI going to be able to give vaccinations to New Brunswick if there is a COVID-19 uptick, and you're on your side of New Brunswick, what could you ask of PEI as help? So for any province and territory in Canada, there is an agreement that if there's a need to have exchange of human resources for situations that are urgent, and a request can be made. And between New Brunswick and PEI, the only thing that we discussed recently was that with the case of a large number of cases of COVID-19 and needing hospitalizations and intensive care, PEI did not have the capacity. If they didn't have the capacity, they would send patients here in New Brunswick. But that is an agreement with the capacities, and the patients would be moved. But there's also, like I mentioned, an agreement between provinces and territories if there was a need to have replacement for human resources or to improve and increase the situations, critical situations, the request can be made. Senator Kasha, do you have a follow-up? Yes? The Premier of PEI said he spoke with the Premier of New Brunswick, Blaine Higgs, by explaining that he was ready to give tests for New Brunswick. So did you make any requests to obtain tests from PEI because you're short of them?
I'll take that one. To the best of my knowledge, no. The premiers are speaking on a very regular basis. I believe they will be speaking again next week. And to the best of my knowledge, we have not made a request of PEI for any additional test kits. I believe that at this time we have what we need, and we have a good amount of testing capacity here.
Monsieur Le Kasha.
Merci.
Bobby Jean McKinnon, CBC.
I'll take that one. To the best of my knowledge, no.
Yes, hello.
Hi, Bobby
Sorry.
Jean.
Hi. Dr. Russell, how soon do you expect the variants will overtake the original strain?
Well, New Brunswick is always a reflection of what's happening elsewhere in the country and elsewhere globally. And we know that right now the UK variant has taken over many different areas. And we get a report from Public Health Agency of Canada very regularly about which countries are affected by which variants. And we also know that here within Canada, British Columbia is dealing with the P1 variant, which is the Brazil variant. We also see some South African variant. So as of right now, the dominant variant here is UK. And in the UK, when it did take over, it took about 10 weeks, 3 months-ish, to take over. So we do expect to see that and are seeing that now. But with each progressive a variant of concern that is aggressive, replacing the previous strains. Again, it's hard to tell at this point in time how that's going to unfold, but again, the three most common ones that we're hearing about and seeing right now are the UK, the South African, and the Brazil, but there are others out there, and there are some yet to have evolved, so we do expect to see more mutations and more variants of concern.
Ms. McKinnon, do you have a follow-up?
Yes, I do. Thank you. Minister Shepherd, New Brunswick, according to the schedule, was to receive 16,100 Moderna doses last week and 23,800 doses next week. Some other provinces are reporting delays with the Moderna vaccine. You said our vaccination rollout remains on schedule. So just to clarify, has New Brunswick not been affected by these Moderna delays?
No, we have. We've had to, we've had to pivot and push out some clinics, but essentially we are at where we thought we would be at the end of Q1 and going into Q2. So, as of April 15th this morning, we've got 157,376 people have been vaccinated with at least one dose, and that's up 6,481 since yesterday, and up 35,908 over the past 7 days. So while we've had to, to pivot and make arrangements to push out some clinics, for the most part, we've been able to manage those. And Pfizer's been very, very consistent, and we've had some additional doses of AstraZeneca that had happened, so we managed through that.
Thank you, Ms. McKinnon.
If I could you just please tell us when you do expect to receive those Moderna doses then?
Yeah, sure. There's a shipment of 16,100 doses that was scheduled for the week of April 5th, and it's arriving this week.
Thank you. John Chillibeck, Daily Gleaner.
Thanks, Bruce. There was news of a Quebec woman suffering from serious blood clots after having AstraZeneca, and now use of the Johnson & Johnson vaccine has been suspended in the United States over similar clotting fears. What would you say to New Brunswickers who are hesitant to receive one of these vaccines? AstraZeneca is available for those 55 and older, and J&J is on its way.
So, John, I've been sitting on a lot of meetings with the Special Advisory Committee, Public Health Agency of Canada, NACI, the National Advisory Committee on Immunizations, and all of the information that they've reviewed, and including, obviously recommendations from other countries. They do acknowledge that there needs to be information included in the product monograph around risks, and as long as those are communicated as of right now, we're waiting for NACI to make the next recommendation around the AstraZeneca vaccine, which we hope we'll hear about on Monday. And again, the risks, when you look at the risks of any of those reported blood clotting issues, in terms of it's a thrombocytopenia-induced thrombocytosis, and we just know that all of the vaccines protect against bad outcomes, hospitalizations, ICU admissions, and deaths. And the risk of somebody having getting COVID in Canada, having a hospital admission or an ICU admission, and ultimately dying from COVID is much, much higher than any of the risks associated with the vaccine. So that's what we're going to be messaging, that to get our province properly vaccinated, everybody needs to get one dose on board minimum between now and the end of June to protect against those bad outcomes, and ideally 2 doses to be maximally protected.
Mr. Chillibeck, do you have a follow-up?
Yes. What's the uptake been like on AstraZeneca for the 55 and older category? Are you seeing any signs of hesitancy because of some of the news out there?
My understanding is no. Minister Shepherd might have heard something different, but to my knowledge, there's no wastage, there's no appointments going unfilled. All the doses that we receive are getting into arms, and it's saving lives.
Thank you. Tom Bateman, Brunswick News.
Good afternoon. I just want to build on Savannah's question about how the virus is still moving around, particularly in Zone 4, but also across the province. When I compare the active caseloads from this ongoing outbreak to the Newfoundland outbreak, which I understand was also driven by a variant, our active case count seems to be declining at a much slower rate. Can you explain that? Why? What would be different about those two cases?
Great question, Tom. Obviously, we would like it to go down much more quickly than it is. Again, different location, different situation, different combination, I guess, of components. But at this point in time, I can't really give a great hypothesis as to why, other than, you know, I think they went to lockdown probably earlier. And again, we're trying to be the least restrictive possible with managing the COVID outbreaks to allow, you know, an open society with education and people able to earn an income, et cetera. So our main goal is to protect our hospital system and protect it from becoming overwhelmed. So all of the steps and decisions that we make, you know, we're with that in mind, as well as the public health components. You know, we balance all that. We balance all the risks when we have our discussions and make recommendations to cabinet. You know, do I wish we were at a lower level of case counts right now? Yes, but are we managing with respect to what's happening with the hospitalized patients? That's going in the right direction. So I think I'm cautiously optimistic that we're going in the right direction. We just need a bit more time. And again, once the case count is at a certain level, to really get it down to zero, it does take time and effort and energy, and making sure that close contacts are self-isolating, et cetera, to decrease that transmission and eliminate it. We do have some community transmission, which I don't think Newfoundland had. So we have several cases that we weren't able to link to the main clusters. So I would say that that's probably contributing to it as well.
Mr. Bateman, do you have a quick follow-up?
I do, thank you. So will this inform health protocol or policy on future outbreaks? Will we move faster, for example, to go into lockdown, or will we change what a lockdown means based on what we're learning here? Thanks.
Not necessarily, Tom. I feel like the information that we have at the time that we make the decisions is very relevant, and again, I think that we do learn from every outbreak, and it might be hard to make that kind of assessment in the middle of this outbreak. It might be better to look back after it's over and see if there were things that we could do differently. Because certainly, leading up to this one, we've always utilized whatever information that we can in real time, and then looking back if there was anything that we could tweak. We always have after action sessions to really go over everything with a fine-tooth comb. But at this time, I feel like we're doing everything we can with the information that we have each and every day.
Thank you, Mr. Bateman. Eloise Rodriguez, Radio-Canada.
Yes, my question is for Dr. Russell. At the beginning, you told people that if they're vaccinated to be careful. Is it because you noted people were getting lax in their behavior in New Brunswick? Not necessarily a lax, it's just relaxing. It's just a comprehension of the level of protection that the vaccination can give them 14 to 21 days after they're vaccinated. Sometimes it's a situation, it's not anything that they control. They're in a situation, like in the residents, special care residents, the effect of being in that situation and to having received a vaccination in proximity of other people who are positive for COVID-19, there's not too much they could do in that situation. But the information that we give today is really to give a level of understanding with the risks involved, and the protection with one dose of the vaccination is not there yet, except for after you're vaccinated after 14 to 21 days before. And the more protection that you have is with the second dose. And once again, 2 weeks after the second dose, depending on which vaccination you received. And waiting by all the population to have their first dose, it's then that we'll have the entire population, the protection with the population, with the people. And still there's some people who are vulnerable because they were not vaccinated, and we know with the variants, it's more contagious and the symptoms are more serious and severe, and it requires more people to be hospitalized and to be admitted in intensive care. Rodriguez, do you have a follow-up question? Yes, quickly. Simply, you mentioned somebody at the hospital who was vaccinated twice and received both doses after 2 weeks. Do you have more details about that case? Maybe to tell people how it's possible that somebody who was completely vaccinated finds themselves at the hospital. Yes, so the protection, the efficiency, we know with all the research is between 94% or 96%, but it's not 100%. So if we have 100 cases, that means that even if you have 2 doses of the vaccination, maybe 4% or 6% of the population were not going to be protected. So that's why the entire population should be immunized with 2 doses to obtain the maximum protection possible for the population in order to avoid situations of being hospitalized. Thank you, Ms. Margot Casteda. My question is for Minister Shepherd. The regions that go to orange levels today in Zone 4, should they have municipal elections reestablished? Or where are we with municipal elections, in other words? Are those zones in the orange or yellow?
It's my understanding that Elections NB have been given the authority to determine how to proceed or not proceed in the alert levels. I believe at orange, I think that they're able to proceed, but we will always leave that determination up to the electoral officer.
Thank you, Minister. Merci beaucoup, Ministre. Mademoiselle Casteda, as-tu un suivi?
Mr. Quesada, do you have a follow-up question? Yes, I'd like to know if New Brunswick, do you believe putting in place if clinics get vaccinated, for example? Do you think about what do you think about the vaccination passport or visa or passport?
I can't really respond to that today. I think that the federal government is exploring options, and I guess I don't even think we're anywhere near a decision on that. I couldn't comment on that today.
Merci, Margot. Adil Ibrahim, CBC.
Adil Ibrahim, CBC. Merci. Ma question. Le Dr. Russell, que les variants ont changé la façon dont on fait le dépistage. Prévoyez-vous changer les règles d'auto-isolement à cause des variants également? Par exemple, prolonger le temps d'isolement pour le contact de variants positifs, comme l'Alberta l'a fait? Nous l'avons fait pour un certain temps. On a changé à 21 jours, mais on a regardé les données, on a considéré nos propres informations. On a décidé de revenir à 14 jours. Et nous sommes confortables avec cela. S'il y a des différentes situations et des circonstances différentes, que le préposé au médecin le fasse ou changer, c'est leur prérogative. Mais à ce moment-ci, ce que nous considérons, c'est l'auto-isolement pour les gens en termes de milieu de travail. S'ils ont un vaccin, 2 vaccins, 2 doses de vaccin, etc. Et ça va être révisé continuellement en tenant plus de données ici pour une fois que savoir ce que sont les risques avec de plus en plus de gens qui sont vaccinés. S'il y avait une question de suivi aujourd'hui? Oui. Le Dr. Russell et le ministre Shepherd, vous pouvez le mentionner s'il y a quelque chose à ajouter. Pouvez-vous nous dire les changements ou quels seuils ont été atteints dans les jeunes?
I think what I can offer there is that as public health is able to determine by testing, we haven't seen any increase in those areas. And so we can tell that the majority of the cases are contained to the Edmundston metropolis area. And so in trying to understand or trying to appreciate how difficult this time has been for Zone 4, we are trying to be as flexible as possible, understanding that we are cautioning against anyone in orange or yellow traveling to the Edmundston Madawaska region where they are in lockdown, and we are stating that it is not appropriate for anyone to leave that area unless it is for the absolute most essential needs, such as essential goods.
Thank you.
Thank you. Voilà la fin de...
So, thank you. That's the end of our update.
That concludes today's update. Thank you very much.